Hope Adams, a certified nurse midwife at Essentia Health St. Mary's in Detroit Lakes, can tell you a lot about midwifery, not only because she is one, but because a midwife helped her to deliver 2 of her own children. She sat down with us to talk about the most common misconceptions people have about her profession. Midwife myth number 1, you must deliver at home with a midwife.
I think a lot of people assume when they hear nurse midwife that we deliver babies in the home. That's still the number 1 question that I get.
In fact, Adams says only about 2% of midwife deliveries are in the home. The rest deliver in the hospital. Midwife myth number 2, midwives only care for you during labor and delivery.
We can do so much more than that. We can see patients from the teenage years through menopause, and so we really are able to form that bond with the patient and care for them throughout their lives.
Adams says midwives, most of whom have master's degrees and are highly trained, can do general health screenings, give vaccinations, test and treat for STDs, and they can prescribe some medications. Myth number 3, a midwife means you bring your bundle of joy into the world with no drugs. However, Adams says the midwife's job is to advise you and offer you what you want for pain management. It's up to you whether you choose relaxation techniques, epidurals, or nothing at all. Myth number 4, if your labor becomes high risk, the nurse midwife will leave as an OBGYN takes their place. Adams says, not true. Should a patient need a C-section, the nurse midwife will stay with you and assist the OBGYN. All of these myths aside, Adams says the main thing to remember about midwives is their primary goal, empowering women and being with them every step of the way during this most important part of life. With this Essentia Health Medical Insight, I'm Tracy Briggs.